Minister for Health Stephen Donnelly is with me in studio. Minister, good evening. You're very welcome to the show.
Kieran, thank you very much for having me in.
A couple of things to talk about. This Women's Health Action Plan, this huge launch today. There's an awful lot in it and I want to talk about it in just a moment. But first of all, the €100,000 ex gratia payment to the bereaved families of healthcare workers who passed away because of COVID-19. Can you maybe explain to us a little bit of detail, what detail does exist and how that's going to work?
I can. I wanted to bring something forward to alleviate the short-term, at least the short-term financial burden for families of healthcare workers who died in Ireland during COVID, who have died at work. The HPSC has identified 22 women and men. There may indeed be more. It's not limited to them. It's a very broad scheme. It's hospitals, public hospitals, private hospitals, nursing homes, long-term residential care, disability services, primary care, general practice, home care, all of it. It's €100,000. It's tax-free. It was important to me that it was tax-free and that obviously there's no amount of money could come close to compensating. It's not really about that, obviously, but it was important that it was a high level by international standards. So the UK have a scheme in place that's £60,000. This is €100,000. And really importantly, it doesn't affect any other payments that families may get, and it doesn't affect any of their legal rights.
So there's 22 people who've been identified who fall into this category. As you said, there may be more. How will we identify who else? Because I assume there might be some confusion over where people contracted COVID, particularly when we go back to the early days, and maybe kind of contact tracing to source wasn't often done.
Yeah, so the application is being put in place by the department with Pubble. We want it to be non-adversarial. It needs to be very easy and compassionate for people to use. So there will be a process there. I'll announce more details on it. What I got today was government agreement to launch the scheme. There may well be more, as you say. I mean, please God, there aren't, that more haven't suffered in this way. But obviously we look at every case and we'll handle every case compassionately. We can't be having any adversarial approach to this.
Yeah, I don't know. I appreciate that, but I mean, if there's a healthcare worker out there who passed away and the family are bereaved, but they didn't contract, they might have been working on a COVID ward, but they didn't contract COVID in work, the family don't qualify in that case, do they?
What the HPSC has found is that in the vast majority of cases, actually, they did contract COVID at work.
But not in all cases. So those few maybe outside, they're not entitled to anything.
Maybe not in all cases, but it would be quite difficult to be able to pinpoint for any individual, obviously, with a highly infectious disease, exactly where they did. But our ingoing assumption is these are our healthcare workers. The chances are they did contract it at work. And ultimately, we asked these workers before there were any vaccinations to basically run towards the fire, and they did. So it's really important that we just put something in place to recognise that.
So where a healthcare worker died, that there's almost a presumption for the purpose of this scheme that they contracted it in work. That's not going to be something that will be investigated. It would be impossible to investigate, I'd imagine, in a lot of circumstances.
It would be very difficult to conclusively prove where somebody contracted it,
So listen, let's talk then about this Women's Health Action Plan that you've launched today. Tell me about the contents of it.
This is really exciting and it's really historic. And actually, I've just come from the Dáil where we were doing statements on International Women's Day. And my view on this has been that we need a revolution in Ireland in women's healthcare. We're not looking for things to get a little bit better a year at a time. We're not looking for incremental change. We need very serious change. So today has been the culmination of several years of work. Really importantly, this has started with the Women's Health Task Force, with TDs and senators in the Dáil and the Shannon who've been advocating for years. It has been about listening to women, going right around the country, listening to patients, listening to their experiences, listening to the services that they want, the experiences they've had, some good, some not so good, and increasing services, making the experiences better. So today we launched the plan. There's a lot of different aspects to it. I'll just maybe give you some of the highlights.
Yeah.
We're fully funding the National Maternity Strategy, which essentially means more midwifery-led care, much more choice for women, investment in facilities. We're doubling the number of lactation consultants. We're putting in place perinatal mental health teams right across the country, which is really important, and the initial results are fantastic. There's a lot of support being provided to women from them. We're introducing free contraception. We're starting with women aged 17 to 25. What I'd like to do in the coming years is expand that to everybody.
Why the age limit initially?
You have to start somewhere. That was the initial expert advice we got. It's an expensive thing to do. So the full year cost just for 17 to 25 year olds is about 25 million euro. So it's a lot of money. So you got to start somewhere, but I'd like to see it expanded as quickly as possible. We're also opening up regional fertility hubs. One of the things I'd like to do in future plans, for example, is look at funding rounds of IVF for women, for couples. It's something we don't have here in Ireland. It's something I think we need. I'm bringing in the Assisted Human Reproduction Bill into the Dáil in the next 2 or 3 weeks, and that gives us the legislative basis to do this. By the end of the year, we will have opened a national network of 20 see and treat gynecology clinics. These are having huge impact. So up until now, a woman might be referred from her GP to a specialist, then referred for diagnostics, then has to go back to the specialist and then be referred for a procedure. It could be 4 trips and it might take somewhere between 9 months and 2 years. It's now being done in a matter of hours in the one location on the one day, and it's providing much quicker access, better clinical outcomes for women, and obviously a much better experience. It's a really, really important part of it. We're also looking at menopause. We're opening 3 specialist menopause clinics. We're opening more specialist endometriosis clinics as well. We're looking at mental health in a really serious way. So we're putting in extra supports for self-harm, for eating disorders, perinatal mental health, as I was discussing earlier on. So really, Kieran, what the work has done here is look at all the different ages, all the different phases of life for women, and said, are we putting in place all of the services that are required? A lot of these services really haven't existed before in this kind of way. So it's really very, very exciting to see this being rolled out.
So
now,
in terms of getting to that point where fertility, rounds of IVF might be funded by the government or partially funded, I appreciate, much like the contraception, you've got to start somewhere and put in the building blocks. But how far away is that?
Well, I'll be bringing in the Assisted Human Reproduction Bill in the next few weeks, so we'll have that through. Hopefully, that'll be law in the coming months. It has to go to committee, obviously, and go through all of the different phases. But once that's in place, what I would love to see then is a conversation in government about beginning to fund IVF. Personally, I'd love to start seeing it funded from next year through the budget. Now, that's part of a bigger budgetary conversation.
But that is part of the budget 2023 conversation.
Well, it certainly
will be.
It certainly will be for me. Now, we'll see.
Allows it in
we'll
or not.
see. You know, but look, the government has put women's healthcare as a top priority, and what we're seeing today is a really serious move in that direction, bringing in lots of new services right around the country.
The contraception, again, just to ask a question about it, how will that work, the mechanics of it? Is it through primary care, through general practitioners? Will there be certain types of contraception kind of allowed under the scheme and others not so?
No, all of it. All of it.
Will 17-year-olds need the consent of their parents?
No. So, for example, the visit to the GP will be funded. Follow-up visits with GPs will be funded. Anything required in a pharmacy will be funded. Anything required in a hospital will be funded. It's all going to be funded. And what a lot of people are saying is, well, that's great for 17 to 25-year-olds, but, I'm 27 or I'm 32. Hear that loud and clear, and we want to expand this out as quickly as possible.
Eating disorder services, then. You might expand a little bit on how they are going to be funded, because we've been speaking about it on this show a bit recently, and I know there was these 3 new treatment hubs that were meant to be opened by the end of last year. None actually opened. I think there was meant to be 16 between 2018 and 2023. 3 of the 16 have opened since 2018. You're not going to get to 16 by 2023, in other words. And there had been an aim to hire about 50 different treatment staff by the end of last year, and funding was only put in place to recruit 20. So we've had plenty of targets, previously, and none of them, it looks like, being hit. Why are we going to hit today's targets?
Well, it's fully funded. It's a top priority, and there are a lot of things already happening. There are people being put in place. Now, you're quite rightly say we have the money, we have the plan. Is there a challenge, particularly in mental health? Around hiring the people who we need sometimes? Yes, there is, right? But nonetheless, the teams are being set up. I mean, in a different area, perinatal mental health. I was in University Hospital Galway at the end of last week. There's a brand new team there. Psychiatry, psychology, social work, lots of different specialties. They're starting with antenatal care, antenatal support. They're going to move to postnatal support. So, this isn't kind of wishful thinking on our part. These teams are being created. The people are being hired, and as you say, in eating disorders,
roles are being created. And I appreciate. Like, I'm not being dismissive of the will here, but I mean, it's the roles that are being created. We don't necessarily know if the people are being hired, and that's good. That is going to be the challenge right across this, isn't it?
It is, and actually, it's a challenge right across healthcare. Right. So again, let's take Galway University Hospital. They have 4 emergency department consultants. They have another 4 posts advertised. Actually, they probably need in excess of twice that amount. We have funded 3,500 therapists into the community in terms of physio, speech and language, occupational therapy, psychology, dietetics. The big challenge for us in healthcare, the money has been allocated, there's really good plans in place. The big challenge, you're quite right across the board, is recruitment, is making sure we find great people, we bring them in, we treat them right, we retain them, and we make sure it's a great place to work for healthcare professionals.
In the short term, in terms of the type of measures then as well, on top of this plan that can help women, because someone has texted in, please ask the Minister about the HRT shortage. This is an issue that has come up in recent days. The consequence may be of a good thing, more and more women coming forward to seek HRT as an intervention in dealing with the menopause, but there is a shortage out there.
It's certainly something that the Department of the HSE are looking at the moment, and it raises another question, which is, what about funding? What about more funding for HRT, and what about more funding for other things as well? Take Caravan. I know you've covered it on this show before. It's incredibly effective, but it's very expensive, and it's not currently.
It's the hyperemesis drug. Hyperemesis is this, women don't like this, but the kind of extreme morning sickness is how colloquially it's referred to now. It's much worse than that, is what people will tell you, and they'll text in as soon as I said that.
Yeah.
But this is the hyperemesis drug, Caravan.
Exactly. Right. So that we've on top of the various measures that we've announced today, we've a €5 million fund for new development for this year as well. So things like funding of Caravan, things like looking at HRT and looking
But how soon will that happen? Because I know you did task people in your department with going out to try and find a way to make Caravan cheaper, and that was a few weeks ago. Like, have they come back with a plan? When will Caravan be made cheaper? It's easier to buy Viagra than Caravan.
Yeah, I've asked the Women's Health Task Force and the department to take a look. They are looking at it. Obviously, we've been very focused on getting to today and making sure that we got all of these initiatives launched and moving. But they are looking at it, and I've listened very carefully, and the department has listened very carefully.
A deadline?
Well, we can't give a deadline at this point, right? What they're working up is different policy options at the moment, but it's something I'd be very interested in looking at some of that additional funding to deploy.
So for the time being, the message to women out there suffering hyperemesis is just bear with it and keep forking out for the Caravan. Eventually, I'll have a suite of measures that I can consider.
I don't think that'd be a fair characterisation. I think what we're saying is we've put in place a fund. It's €5 million. I've asked the Women's Health Task Force to take a look at this. We've listened very carefully. I believe it's something we should be considering funding. And when I get the options back, we'll look at that very carefully.
One other thing that we've covered in this show as well that I wanted to ask you about, and I've asked you about this before. I know you were at the National Maternity Hospital for a photo call yesterday, and there was women in the background waiting for antenatal appointments and waiting on their own because their partners are not allowed in with them. Why is that still happening?
Well, we were in Holles Street, and actually there's very few restrictions in Holles Street other than restrictions that would have been in place pre-COVID. Most of the restrictions...
No, women are still being denied access with a partner to antenatal appointments there and elsewhere.
No, I hear you, but most of the restrictions around COVID have been lifted. Any remaining restrictions in place have been put in place locally for one reason and one reason only, which is to protect mums and to protect babies. I don't have the figures with me, but I think you and I might have gone through them before in terms of the number of the disproportionately high number of pregnant women who've ended up in ICU with COVID. There is a very real concern from obstetrics, from infection prevention and control experts who work in maternity, that there is a need to keep pregnant women safe, and there is a need, obviously, to keep the healthcare professionals safe as well. In fact, the one of the healthcare professionals who led that we were opening 12 new labour and birthing units yesterday, all en suite. Really good to see. One of the lead people on it had to join us from the mobile phone because they were at home with COVID. So I am acutely aware of the asks and the need for visitation and partners to be there. The only reason, Kieran, any maternity hospital or any maternity units would have any restrictions in place is to keep mums and babies safe.
Yeah, but listen, NPHET would have been acutely aware of that as well. Yet when you ask members of NPHET about this, they said there was no public health rationale for maintaining restrictions in the maternity hospital system. Yet those restrictions still exist on public health grounds. So, I mean, are NPHET wrong or are you wrong? Can't both be right.
No,
if you're saying there's a public health rationale and NPHET are saying there was no public health rationale, then one of you is wrong.
Well,
I doubt you're going to say it's you. So why are NPHET wrong?
No, in fairness, that's not what NPHET said. Right? What NPHET said was at a national policy level, there's no need for national policy, but they did recognise that individual hospitals, individual maternity hospitals and maternity units may have to make local decisions. But both I and NPHET NPHET is gone, I guess, but would have been very much of the view, and I'm still very much of the view, that there should only ever be restrictions in place if there is a very clear and compelling risk to mums and babies which warrants them being in place.
Before I let you go, let me ask about Ukrainians and Ukrainian refugees who have made their way here, some who have already made their way, others who will be on the way. You'd imagine many of them will have medical needs. What sort of services are we making available to them?
We're doing several things, and I met with the Ukrainian ambassador yesterday, and she was telling me about what's being experienced by her countrymen and her countrywomen, and it is just horrific. Can I say that what we need is a full and unconditional withdrawal of Russian forces from a sovereign Ukraine. It's outrageous. We potentially will have a lot of people coming in. We've had over 2,000 come in so far, a lot of women, a lot of children. There's several things we're doing. One of the things we're doing is an initial health assessment. We'll be providing mental health supports. Unfortunately, there's likely to be men, women and children coming in who've been traumatised, who are going to need supports. We're putting in place access to general practice. Access to general practice in the community. We're also looking at urgent care needs. Inevitably, there are people coming in who are going to need hospital treatment straight away. There's also a number of people who have underlying conditions who are going to need ongoing help, be it dialysis or other conditions. Everyone is going to get a medical card as well as that. Okay. Well, listen, Minister for Health Stephen Donnelly. Minister, thanks a million for joining us. Kieran.